Hello, today we're going to be talking about health equity. And health equity means that everyone has a fair and just opportunity to be as healthy as possible. To disclose here as a disclosure, this project is supported by HRSA of the U.S. Department of Health and Human Services. It's a grant for the Geriatric Workforce Enhancement Program. The information or content and conclusion of those of the author and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, Health and Human Services, or the U.S. government. Okay, so this presentation aligns very naturally with the Age-Friendly Health System Forum's framework, and we'll talk about that throughout this presentation. And the reason it aligns well is because health equity directly influences how older adults experience care, how they access services, communicate with providers, and maintain quality of life. And by the end of this presentation, you will be able to define health equity and related terms, explain how social and environmental factors affect health. You'll be able to identify barriers patients may experience when accessing healthcare. You'll be able to demonstrate respectful and culturally sensitive communication and recognize the important role of healthcare providers or the role they play in promoting health equity and be able to apply health equity concepts to patient care situations. So what is health equity? It means that everyone, as I said earlier, has a fair and just opportunity to be as healthy as possible. That means that patients receive the care they need. The care is respectful and it is fair, and patients are not treated differently because of age, race, disability, ethnicity, income, language, religion, gender, sexual orientation, insurance status, or where they live. Okay, so key terms. Equality means that everyone gets the same thing, and that is illustrated on the right of this graphic, where some can reach the tree and others cannot, and they're all on the same size stool. So everyone is getting the same size stool. Equity, however, is when people receive what they need to succeed or to stay healthy, and that is illustrated on the left side of this graphic, where people are given a stool that fits their height in order for them to be able to reach the tree. And some examples are that if you have a patient whose language may not be English, or the patient may need an interpreter, you'll be able to provide that for the patient. And also, you might have a patient who needs transportation assistance, or a patient who has low vision, or and may need written instructions in larger print. So let's talk a bit about the social determinants of health. Health equity means recognizing that patients have different life challenges and providing the support they need to achieve the best possible health outcomes, right? These challenges may include a neighborhood and built environment or where they live. And we'll talk a little bit more about this later on as well. Uh, Also, one of those challenges might be health and healthcare access, economic stability, education, social and community context. The social determinants of health affects patients. For example, a patient might miss appointments because they lack transportation. They might skip their medications because they cannot afford them. They may have poor nutrition because healthy food is unavailable, or they might feel isolated or depressed because they live alone. And they may delay healthcare because they're fearful, they have a language barrier, or they are not health literate. They do not understand the importance of healthcare. So why does health equity matter? Healthcare professionals spend a lot of time with patients, and because of this, they can play an important role in promoting equitable care. They may notice the changes in the patient first. These changes may be things that need to be addressed that aren't medically related. Also, this interaction can build trust And also your ability to for the patient to speak to you, and perhaps they will be able to talk to you and communicate with you their issues. And also for you, for on your part, you need to be able to listen well and listen to the patient concerns, and also help patients feel respected and safe. So here's some examples of health equity. Uh, Transportation, for one, a patient may miss a dialysis appointment because they don't have reliable transportation. That could certainly affect their health. A patient may not understand discharge instructions because English is not their primary language. So you might need to find an accommodation for that patient in terms of uh, an interpreter or someone who can read the discharge instructions to this person in their own language. Also, a patient may be using a wheelchair and they may not be able to access parts of the clinic or being able to navigate where those entrances might be. And also, there might be some financial challenges when a patient needs to cut pills in half because they need to make their medications last longer. So, biases and assumptions can also affect health equity. Bias is a preference or assumption about a person or a group and can sometimes happen without even realizing it. And some of those examples are assuming that a patient is non-compliant when they're not taking their medications, or they're not showing up for their doctor's appointments because they don't have funding, they don't have transportation, etc. Also, assuming an older adult cannot understand information if English is not their first language. Perhaps they still do understand it. Assuming a patient exaggerates their pain. So there needs to be, uh, you need to listen and investigate these things. So how does bias affect care? Bias can lead to patients feeling disrespected. So they're not going to communicate well with you. They're going to delay their treatment. They're going to avoid healthcare altogether. And also, this bias will generate lower quality care. So, caring for diverse populations. So, some older adults may have hearing or vision difficulties. So, you need to be cognizant of that. They might fear losing independence because of a medical condition that they have. And they also might need extra time with you in order for them to understand and process the information that you're providing to them. Patients with disabilities, ask them before helping them if they want help. Respect their autonomy, that they are the ones that makes the decision about their body, and also speak directly to the patient. The patient is in a wheelchair, you speak to the patient, not the person that is standing next to them. So also, you might have patients from different cultures as well. And so you want to be respectful of their traditions, their customs, and also avoid stereotypes and ask questions respectively. Okay, trauma-informed care. So health equity can also be affected by trauma. Trauma itself is a deeply stressful or disturbing experience by a patient. And some of those examples would be that your patient may have experienced abuse or violence, or they have a serious illness, a loss of a loved one, and also disasters like floods, like hurricanes, tsunamis, etc., tornadoes. We've had lots of those in lately. So what are some trauma-informed approaches? Well, healthcare professionals need to be able to remain calm, explain what you're doing, explain the care before you touch the patient, also respect their privacy. Also, if there are choices to be made, offer those choices when possible to make them more comfortable and avoid any sort of judgmental language. And over here in the graphic on the side, I have a little link here as well. If you want to look at the 6 trauma-informed core principles, I would love to go into those right now, but it would be a totally different type of lecture. Okay. So the importance of dignity. Every patient deserves respect. They deserve their privacy. They deserve compassion. And they also deserve independence when possible. And also, they need to have a voice in their care. They need to be part of that partnership with the healthcare provider. Small actions matter. Knocking before entering the examining room, or even if you're in a long-term care facility, their home, even, etc. And also, if a patient is not covered, cover them appropriately as well. But of course, you want to ask them about that. You want to, maybe they don't know it even. So you want to be able to protect their dignity there as well. And also explain everything you're doing, explain all those procedures, and also ask them what the preferred name is and use that. So, case study activity. Mrs. Johnson is an 82-year-old woman who is living alone. She frequently misses appointments and appears tired and withdrawn. During the conversation, she mentions she cannot drive anymore and struggles to buy groceries. So, let's talk about those social determinants of health that we discussed earlier. So, how does that affect Mrs. Johnson? So, I'll let you think about this for a second. Okay. So let's discuss this together. Mrs. Johnson may be affected by limited transportation, and she might have social isolation, so she's feeling lonely. She may have food security because she struggles to buy her groceries. And she also has concerns um, of missed appointments, that she has difficulty accessing healthcare. She is feeling fatigued. She feels withdrawn. The inability to get groceries is also worrying to her, and she may be experiencing possible malnutrition. There may also be some safety concerns. She's not driving anymore, so there might be some concerns there for safety that need to be discussed. There also may be signs of depression or declining health care. So the healthcare team can support her by arranging transportation services, connecting her with community resources or meal programs, and assessing her mental and physical health, and involving social work or family support when appropriate. Okay, so what are some key takeaways here? So health equity means that giving patients the support they need to achieve the best possible outcomes, not simply treating everyone exactly the same. Such as we had talked about earlier, the need for transportation. Obviously, Mrs. Johnson needs some nutrition support and much more. The social determinants of health, such as transportation, housing, food access, income, and social support, can greatly affect a patient's health and ability to receive care. She might be living in a neighborhood with, that may be, where there might be crime. There may not be sidewalks, safe places to walk, etc. Healthcare professionals play an important role in promoting equitable, age-friendly care through respectful communication, compassion, observation, and reporting patient concerns. Small actions such as preserving dignity, listening carefully, and respecting patient preferences can make a significant difference in patient trust, safety, and well-being. And thank you so much for allowing me to share this important information with you. If you have any questions, you can call the SLU Family Center for Health Aging. My email address is also on here, and there's a phone number there for the Family Center for Healthy Aging, and several links to access to offerings that the Family Center for Healthy Aging has as well.